Good day, everyone. This is UDS Catron, your student midwife. For today, I'm going to demonstrate on how to do the Leopold's maneuver. But first, we have to know why we need to do this maneuver. So Leopold's maneuver enables us to assess the fetal orientation. And this maneuver has 3 steps, which is first is the inspection, second is the palpation, and third is the auscultation. So for the inspection, we need to do this with our both eyes. And also for the second step or process, which is the palpation, we need to do this using our hands, bare hands. And for the third one, which is the auscultation process, we have to use this through our ears by listening to our stethoscope. So before we are going to do this, we have to ask the permission of our patient first. And if our mother agrees, then we will explain to her the procedure. And after explaining the procedure, we will let our mother do the supine position and with both legs flex or bend, and we have to put a soft pillow or a roll towel under each side. And afterwards, we have to do the aseptic technique. And since I am done washing my hands and doing aseptic technique, so we will proceed to the next step. And we have to look for the mother's abdomen, for the abdomen shape, if it is vertical or if it is horizontal or transverse. So if it is vertical, then we can assess that it should be, or it could be the presenting part is cephalic or breech. But if it is horizontal or transverse, then we can say that the presenting part could be the baby's shoulder or the baby's hands, like that, because it is breech also. And we have to look also for any scars. If we can see that there is a scar in the symphysis pubis, then we can assess, or we can conclude that our mother undergone cesarean section before. And for the second step, which is the palpation, it needs our hands. So with that, we will do the maneuver itself, which is we have to do the first to fourth maneuver. Before doing our Leopold's maneuver, the 4 maneuvers, we have to rub our hands first so that we can provide a heat to the mother before putting or touching our hands in the mother's abdomen. So rub it first, and then we have to do the first maneuver, which is to identify what lies behind or inside the fundus. So we have to touch like this and feel what lies behind the fundus through our hands and our fingers. So if it is soft, then it could be the buttocks. But if it is hard and round, then it could be the baby's head, or it is breech because the head is in the mother's fundus. And for the first, second, and third maneuver, we have to face the mother. And for the second maneuver, we have to feel what lies in each side. So we have to know, or with this, we will know where is the position of the baby's back and also for the baby's extremities. So like that, we have to feel. And if we can feel that it is hard and also it is plain, then it could be the baby's back. But if we can feel that it is irregular and soft, then it is the extremities. So like that, if this is the softer one and the irregular, then it could be that this is the extremities of the baby and this is the back. And for the third maneuver, we have to know what is the presenting part by putting our one hand in the symphysis or above the symphysis pubis of our mother, and the other hand in the fundus to support. So with this, we have to know the presenting part. If we can feel that, we have to grasp it using our fingers and our thumb. So if we can feel that it is hard and round, then it is the head of the baby. But if we can feel that it is soft, then it is the buttocks maybe of the baby, or it is cephalic, it is breech. And this is the third maneuver. For the fourth maneuver, we have to face the patient's or the mother's feet, and we have to feel each side again. But with this, we have to feel it inwards and downwards. With this, we can know the fetal occipital prominence, and also we will know if it is already engaged or not. So inwards, downwards, we can feel if it is already engaged, or the head of the baby is already in the pelvis. So this is the fourth maneuver. And after doing the palpation process, we have to, or we will proceed to the next process, which is the auscultation. Through auscultation, we can hear the fetal heart rate or fetal heart tone. So if this one, during our second maneuver, if we can feel that this is the extremities in my right hand, and this is the back, and it is best to listen the fetal heart tone in the back of the baby. So we have to listen and put our stethoscope here, and don't forget to, if you are using Doppler, don't forget to put a jelly in the mother's belly or tummy, and we can listen to the fetal heart tone. And remember also that the normal heart tone of the baby is, or the normal fetal heart tone is 120 to 160 beats per minute. And if, or during 6 months, if we can't hear any fetal heart tone and there is no fetal movement, then we have to refer the mother. So once we are done with our 3 steps, then we have to thank the mother for giving us the permission, and we have to record all our findings. And that's how to do the Leopold's maneuver. So thank you for watching, and I hope you got something from it. Thank you and God bless. Bye!